Well, I was interested in researching specifically special tests because I was concerned that a lot of clinicians were using the wrong tests in clinical practice. Well, I believe, even as a physiotherapist, we constantly differentiate different tissues, structures, different diagnoses in patients, even if they come to us with a diagnosis. Because our research has actually shown that physicians are only correct in their diagnosis in about a third of the cases. Thus, we deal with a lot of patients who have conditions that were not originally diagnosed. So differential diagnosis improves our ability to truly target the problem of the patient and to focus our interventions on what really needs to be done. As far as research in physical therapy, the sky is the limit. I think we've only scratched the surface on what we can do. With respect to the type of research, I think research in pain science is going to be an area that we're going to greatly grow in, and certainly our interventions. We're starting to see that certain types of interventions are more effective than others. The bread and butter of what makes us physiotherapists is exercise prescription, and we're learning that exercise seems to help everybody. It seems to be the common denominator in all studies that improves all conditions. The best types, the best dosage, how long somebody should exercise, we don't know that yet, but we're learning things as we go. Well, it's my hope that the students in this course actually learn that certain tests are actually better than others. But the underlying thing that I want them to know is that there are limitations with special tests, every special test, that their movement examination, their composite examination, the patient history that they take, all of these are very important. All of these things must be considered during the care of the patient. That a special test by itself, it means very, very little. If I could give advice to new physiotherapists, I would find a great clinician and I would ask that person to be my mentor, and I would listen to them, and I would find out what made them great and how much of their dedication was required to excel. I would also read the literature. I would read as much literature as I could and try to understand that literature and then incorporate it into clinical practice. I have rarely seen such an eager, motivated group of clinicians. I wish I had more time. There are so many questions and so much to talk about. As a teacher, I learn as much as I teach. And to get the perspectives of clinicians from somewhere else is very valuable for me. So it's been a wonderful experience. I think clinical research has done our profession so much good. It has really changed us from being purely an art to being an art and a science. I think we have a long way to go, but I love the direction that we're going.